Stump, and I'll be talking about my topic of universal healthcare in America and if healthcare should be for one or for all. When it comes to healthcare, should we be thinking about ourselves or our country? The term healthcare can be defined as the maintenance of health by undergoing treatment or the prevention of disease by a trained professional. When we go to the doctors, we go with the expectation of enhancing our quality of life, which will create a positive effect on our well-being. But sometimes people cannot prioritize their health needs because they cannot afford it. But on the contrary, what if the wait to see your doctor was so long, you go home and just hope your symptoms go away? Healthcare in this country is deemed as a right and not a privilege for all human beings. Modernized medicine can go back to the early 1900s when a unionized organization began to develop and medicine began to flourish. Universal healthcare is something 50 countries in the world have undergone, but America is one of the most developed first world countries to not participate in this. Some Americans state that the reason America has yet to participate in this is due to the citizens prioritizing themselves over the country as a whole. Today I'll be giving you two sides of this topic in hopes to help you decide whether or not you believe America's healthcare system should be free. If our country decided to implement universal healthcare, we can see the medical debt rate decrease and the livelihood of American citizens increase. Within the last 7 decades, medical expenses have rapidly increased, which takes a toll on the vast majority of Americans when it comes to money. The price of healthcare started to become a problem in the 1950s when in-hospital care rates doubled. Heading into the 1960s, non-working Americans and the elderly had trouble affording their healthcare. In the 1970s, American medicine entered a crisis period with rapidly escalating rates and inflation of the economy. In the present day, we can see that medical debt has significantly increased and has become a detrimental problem to many Americans. When it comes to money, we can see that the government spends roughly $997 billion a year on healthcare for insured people under the age of 65, and the yearly number keeps growing. Yet 23 million American adults in the United States are currently in medical debt ranging from $200 to upwards of $10,000. By looking at the chart on the left, we can see how debt can easily accumulate as your hospital stay increases and the more testing a doctor may request. By looking at the chart on the right, we can see the various ranges of medical debt surveyed Americans are in, $2,000 to $5,000 being the most common. Although the majority of individuals wish to worry about their money over health, certain decisions can benefit the government by saving money as well as increasing the lifespan of a lot of Americans. With that being said, many state that with free healthcare, the livelihood as a whole for Americans would increase. According to Jenny Blair, a writer for the Yale School of Public Health, if the U.S. had had a single-payer universal healthcare system in 2020, nearly 212,000 American lives would have been saved that year. The country would have saved $105 billion in COVID-19 hospital expenses alone. This shows that the universal healthcare can help both the government and the citizens of our country. With how much money the American government spends on healthcare, we have a lower life expectancy and a higher maternal and infant mortality rates. Our country, being as strong and powerful as it is ranked nearly dead last within the healthcare ranking systems of industrialized countries. Even though our country spends a lot of money on the healthcare system, we see that it doesn't help everyone, such as the ones who cannot afford it. Our baseline health insurance coverage covers the bare minimum, and oftentimes people end up not seeking the care that they need because they rather suffer than drown in debt. It's been proven that while insurance is needed in this country to get health care, sometimes it's not enough. Insured Americans can accumulate debt from care that is not covered, claims that were denied, and procedures that were only partially covered. The remaining balance a patient has that insurance doesn't cover is what they have to pay out of pocket, which ultimately can put them in debt. Unfortunately, every year we see a rate of increased Americans dying of untreated or undiagnosed illnesses because they cannot afford to take a trip to the doctor's office to get better. More than 45,000 Americans each year die from being uninsured or underinsured. Becoming ill is not in the cards for anybody, but sometimes curing our disease becomes unpreventable for the sole reason that it's expensive and at times unaffordable. Now that there's an understanding of why we as a country could benefit from a change in the healthcare system, here's why it would not be beneficial. Healthcare for all, which sound good in theory, could affect patients' health and finances as well as the internal healthcare workers. Regardless of one's health, everyone will not only be paying the same amount of money for healthcare, but everyone will be paying more money. On one hand, there's a chronically ill man diagnosed with a sickness that requires him to be hospitalized in order to live. On the other hand, there's a healthy young male who very rarely visits the hospital or the doctor's office and maybe catches the flu once a year. With universal healthcare, these two individuals will be paying the same amount of money for healthcare, yet their situations couldn't be drastically different to each other. As a big bulk of our country can safely say they are middle-class citizens, a lot still have to try to make ends meet when it comes to their finances. There's an array of different health insurances individuals and families can choose from that best suit their situation both personally and financially. With eradicating health insurance and making healthcare free for all, this might end up costing citizens more money in the long run due to the fact that their current health insurance plan could potentially be less expensive than the increased tax rates free healthcare would provide. While this may sound like money is the only downside of free healthcare, sometimes we have to think of the healthcare professionals and not just the citizens. If we made healthcare universal, doctors' performance quality would decrease and the patient wait time would increase. Doctors already have a hard time determining how to prioritize patients based on their status, but with an increase in patient overload, this increases the chances for a doctor to make a mistake that could potentially be fatal to their patient. The quality of care which health professionals strive to achieve will overall diminish for the ones who need help the most. In countries where they have free healthcare, patients could be waiting months to years to get treatment for their illnesses, let alone to visit a doctor. With the increase of people going to the doctor, the critically ill patients sometimes get overlooked and their conditions can easily worsen. This chart explains the differences in wait time between America and Canada. Canada is a country with universal healthcare, and by looking at this chart, we can see that for every specialty doctor a citizen may need to visit in Canada, their wait is at least 2 times longer than the wait in America. Even with doctors struggling with patient overload, what would happen to the people behind the scene, the scientists and the researchers? Expansion of healthcare could potentially lead to medical advances coming to a halt as they would be made as an afterthought. If we made healthcare universal in America, would there be remaining funds for other health-related aspects? The American government would firstly prioritize the citizens when it comes to free healthcare, and the bulk of the money would go to providing care for them. However, this leaves scientists and researchers in the medical field with less money to continue to make modern medicine flourish. By expanding the access to medical care, it would diminish the research aspect that also comes along with medicine. With the less government funding they are receiving, the less likely we can continue to modernize the way we perform various procedures, curating new drugs, and futuristic health advancements that have the potential to help patients. Many wonder about how we proceed with this, and they ask, should we be thinking about ourselves or our country when it comes to healthcare? The thought that the United States should pursue the idea of universal healthcare for all is perplexing because both ends have their pros and cons. We can see that providing free healthcare, more lives would be saved because people who cannot afford it are now able to. On the flip side, the quality of care and doctor performance would decrease because the patient rate would increase. We can all pay more money even if we don't visit the doctors often, or the large group of individuals who struggle to afford healthcare continue to suffer. The battle of if healthcare should be free or not is a constant battle between individualism and nationalism. Do we worry about ourselves or do we worry about everybody else? I hope this gave you all something to sit and think about whether you believe healthcare should be universal or not in America.